Count the kicks.
That's Candace's, like,
I know.
that's like her thing. Yay!
I don't even remember how I came up on it. I think I was, we were in the VBAC group at the time, and I think it was a post that popped up, and I'm like, this is some really good info. We need to get out there. And I showed it to the admin group at the time, and they're like, a lot of us never even heard about it or knew everything about it. So sharing this information in different due date groups, parenting groups, all that. So I'm happy to share what I know. And let me say, I'm not a professional. And most of this information I get is from 2 sites, which we'll link. I'll start out with the most, I guess, not a myth, but what we hear in America a lot is count the kicks. And that's 10 counts. You're good. You're done counting as long as you got 10. That's it. That's all you have to do once a day. And we hear that a lot. And I know it's changed. So the guidelines have changed, and we're just kind of behind here in the US. And the recommendations is not count to 10. Like if you find your baby moves 10 times or kicks 10 times, that's great. But all babies are not the same. There are some babies that can move 38 times in a session, or, they can move 12. So the 10 count is outdated. You get to know your baby. The first, I know everybody's different about when they start feeling their baby kick. And I say kick, what I mean by kick is movements, jabs, swishes, rolls, not just kicks. So I'll refer to that as movements right now, not just kicks, but we know it as kicks. So movements, jabs, kicks, rolls, swishes are all movements that you need to pay attention to. And a lot of people don't start feeling their baby till second trimester, and that's okay. Everybody starts feeling their baby differently. So when you start recognizing and your baby's moving, like maybe in the morning after you've had, your drink in the morning, or your baby normally moves at night when you're sitting in bed and watching TV. So you want to start picking up on this baby's movement pattern. And twins are a little bit differently, but you can start multiples. You can try to decipher which baby's moving at which time. But we'll go with singleton pregnancy right now. So at night, just say your baby moves at night the most commonly. So you start picking up in the second trimester. Okay, my baby's moving around 7 to 8 p.m. So you start just learning their movements. Okay, they're active between 7:15 to 7:30. And these times kind of go, but your baby's going to be moving then. So you kind of hone in. And this doesn't mean you just concentrate at the night. If you ever notice anything's wrong or just even have a gut feeling, that's one of the best predictors that something is off. And maybe not, but it's always best to go get checked out. If you ever have any questions or stop and think, I haven't felt baby today, or I can't remember feeling my baby today, please go in. Don't even call. Go into labor and delivery and get guidance. They are always willing to tell you, hook you up to the monitor and tell you baby's okay and send you home rather than give you devastating news. So just go in. Please go in. Don't waste time on trying to call your doctor and get seen at the doctor's office. They can't do an emergency C-section if they need to. And labor and delivery set up for that. They have the doctor right there. Your nurses are amazing. They'll get you hooked up and checked out right away. So it's always important. You can call your doctor on the way in. You can call the labor and delivery on the way in, but you don't have to. So that's something else. So going back to kick or movement, counting your movements, just start second trimester. Start paying attention to when they're moving. And so by the third trimester you get there, you have a general idea and know when your baby's most active. And that's when you start paying attention. Hiccups are an involuntary movement, and you should not count those movements at all. They can't control it. So even if baby's in distress and, you feel this hiccup, it's not a movement. And like I said, rolls, jabs, swishes, they're all movements, which is really cool to see. So a lot of people ask if they're in the second trimester and knows their baby isn't moving as much, should they still go in? And that's something you ask your doctor, in your first trimester, and they'll give you guidance on that. But again, if you're ever questioning, just go in. They're not going to turn you away. And I know being in the VBAC group, we've heard some people say like, okay, well, they said I didn't need to come in. You, and maybe if you have your partner or anybody with you, speak up for yourself. My baby is not moving like they normally do. I would like them checked out, and just, be stern. They cannot send you away when you have a concern. And we hear a lot. Another myth is, or not a myth, I guess what we hear a lot is your baby has a decrease in movements when they're in distress. And it's not really, we don't hear it enough, but your baby can have an increase in movements and be in distress. So you might say, oh, well, my baby's moving a lot, and that's not normal, and this is kind of cool, but it's concerning. It can be a concern, put it that way, and something that also needs to be checked out. I know from a Facebook friend that for several years now, she lost her baby and did not know. She just kind of going throughout the day, kind of felt something was off. And then when she had time, she went into labor and delivery and had noticed, her baby was gone. And so she had a stillbirth, unfortunately. And now looking back, she said she noticed that morning that it was an increase of movements and just wished that she had listened to her body. Something was off and just went in. And it's not, no blame on the parent at all, but these are things that, experiences people have had and want to share them with other people, especially around these movements. It's such a big issue. And getting later in pregnancy, we know stillbirth does increase past certain gestation points. So even if you cross that 40 week into 41 weeks, it's very, very important to also have a birth plan with your provider, with your doctor. And that's something, if you're having a home birth, you do need to be checked out by a professional. And I know we speak about home births and we don't recommend them, but if you're going with one, it's still the best thing you can do for you and your baby is to have a backup plan and go get checked out. This doesn't mean you don't have to stay at the hospital if everything checks out, but you just want reassurance and to know that the baby's okay. So past 40, 41 weeks, you'll start going in and having BPPs and hooked up monitor bellies, those 2 belly bands, and you'll go in for non-stress tests, and that's what they are. And they're counting the movements, the heart rate, everything like that. And that's usually what you will do when you go in and say, hey, my baby's not moving like they normally do. So they'll get you in, check you, put you on that non-stress test and get that strip. And the doctor's watching, even if the doctor's not in the room, the doctors and nurses are watching and they know what to look for. And they can, go to a BPP, get an ultrasound, or they may find that baby needs out right away and you're in the right spot for that. And sometimes the baby's just not that active, but they know what they're looking for. You do not know. So if you are at home and you're like, my baby's not moving correctly, so I'm going to drink a sugary drink. I'm going to sit down and try to pay attention and get them to move. So you might start poking your belly and the baby's jabbing you back, or you drink a sugary drink and notice baby's moving. It's still, and that's reassuring to you when you're not a medical provider and you think, okay, well, my baby's moving. I don't need to go in. Please, please do not prompt your baby at home. If they give you juice when you go into labor and delivery, or sometimes they buzz the baby to get a reaction. They do this because they know what they're looking for. We cannot do that at home at all. So please just go in. And if you call your doctor's office and they tell you to drink a sugary drink, and if you don't feel baby move in an hour to come on in, don't waste the time. Just go in. You can tell them you've already done that stuff if you don't want to tell them that you didn't want to do it. Please just go in. Don't waste precious time. And most likely you're going to be able to go home and baby's okay. On that topic, if you go home, baby is okay, and you still notice your baby's has increased or decreased movements, go back in every time. They need to note this, and they can start seeing if there's a pattern and that this baby is in distress. We didn't catch this, or we notice this next time, and this is getting concerning at this point. So we do need to go ahead and get your baby out. It's all for the safety and don't ever feel like you're being a bother. They would rather reassure you and tell you and send you home your baby's fine than deliver the worst news of your life. So that's another thing. And I do have a personal friend. She's a high school friend. And I wish I would have, spoken up more about this instead of in your birth group. So talk to all your friends, everybody, and tell them about these movements, because it could save a baby's life. And so, I've been really active on Facebook groups and everything and sharing them in due dates, and never thought to share it with my own friends. And now, just share this, because there's a lot of things I didn't know about this. I went to 42 weeks with my own baby, with my second baby, and 41 weeks with the first one. And these are things that I wish I would have known. And that was with the OB certified nurse midwife care. So just knowing these things now, I did get lucky, and a lot of people do get lucky, but there are a few, and, just paying attention to these movements is a big, big deal. Anterior placentas, people who have anterior placentas feel their babies differently. Some may not even feel the movements like a harsh movement or feel it, but there are, and we'll go ahead and link that in the video. There are ways to count those movements with having an anterior placenta, which is a lot of concern for a lot of pregnant people when they do have that anterior placenta. And then twins and multiples, it gets a little bit more complicated with counting and the movements and everything. But there are ways to do it, and we will link all that. I think, let's see. Right, so, some of the myths, I don't know if anybody wants to chime in, but the myth that we always hear is, oh, you've reached 39 weeks, or your baby's running out of room. You're not going to feel them kick, and they don't have that room. Which it may be true a little bit, but they're not running out of room. You're just going to feel their movements differently. They should still always be moving the same amount of time that they normally have been. And again, don't wait. Don't say, oh, well, I have to get my kids a bath and get them to bed. Please just go in. Just don't wait. Just go in. That's always what we have to say. We see people in our birth groups that, send in a question that are very concerned, but they don't want to feel silly for going in, and they're wasting valuable time that, could be helping the baby by posting in these groups. And we understand, but we're not going to be able to tell you that everything's normal. We're going to tell you, please go in right now and then give us an update. And let's see, does anybody have any other myths that they've heard?
I was
want to add.
A lot of the time, for some of the people, if they feel the decreased movements, please don't go and get a fetal Doppler or use one that you have and think, I'm just going to check baby's heartbeat. Oh, they're fine. Please don't do that. You deserve good care. Your baby deserves good care. Go ahead and go in and have an appropriate person who can interpret that. Make sure that everything's okay. Don't rely on a Doppler at home.
Mm-hmm. And I liked how you brought up about the home birth, because I never heard about it when I was home birthing. And I think people that are not doing, a hospital birth, I think you should know about it, because you might be planning a home birth or going to a birth center, but if you notice something's off, it's okay for you to go into any hospital that has a labor delivery wing. Just go in, say something's not right. I'm not whatever. You can tell them, I have a midwife or whatever. They're not going to treat you differently. They're not going to tell you, they're not going to care for you. They're going to check your baby. That's what they do. So I really like that you brought that up, because I actually know a lot of women that have birth at home, even right here in my own state, that, they all lost their babies to stillborns right around 40 to 41 weeks. And they had either decrease in movement or a major increase where it was like noticeable. And a lot of midwives, when they call the midwife, says, drink some juice, have some fruit, see if they whatever, poke your belly or Doppler checks, but they're not actually, you can't tell with the Doppler what's really going on in there with baby, with fluid, with placenta. There's like so many different things that they check at a hospital. So I do like that you said that, because it needs to be like, it's fine. You want to have an out of hospital birth, but make sure you're getting the proper care for your baby. If you notice something off, it's okay to go to the hospital, and they can send you home and it's not a big deal, but it's also okay to get the help that you need, because there's no point to have a home birth if your baby's going to come out not living. Like, there's no point. So go in, please go in, just go in.
The one thing is, there are conditions that basically have no other warning signs other than decreased movement. That's it. That's the only sign you get. It's the only chance you have to detect it. And that's one of the reasons why when someone says, well, I called the office and they said, well, what you need to do is, have your sugary drink, take a break, and then, and the thing is it's not so much that it's not good advice, first of all, but secondly, it's delivering a message to the pregnant person that maybe you aren't really, feeling what you're saying. And it's like, well, we aren't taking you seriously. And that's what makes me mad. Because if a pregnant person calls their provider and says, I'm experiencing this, they should, first of all, you validate what they're feeling. Okay, can you explain? Can you tell me what you're feeling? And then the next step is not to say, well, maybe you shouldn't do anything. It should be come on in. And if they don't say come on in, well, then take yourself in. And the other thing is pregnant people who have other responsibilities, they, generally speaking, they're like, well, I don't know. And I have kids to feed. I have responsibilities to take care of. I'm a busy person. And generally speaking, the sad stories either follow one of two patterns. One, the pregnant person says, I felt something earlier in the day, I wasn't sure about it, and I was busy. So I figured, okay, later I'll take care of this. And then later is too late. And then the second story is the pregnant person feels something, they call the provider gives them that kind of dismissive, why don't you try this first kind of thing. And they go, well, maybe I'm not really feeling this. Maybe it's not urgent. And then eventually they do go in and it's too late. So one, your provider should always validate you. If they don't, you have every right to go to the hospital and to be asked to be hooked up and asked for them to monitor your baby. A quick, oh, everything looks fine is not acceptable. If you're worried, ask to have them monitor your baby. And it's at least 20 minutes. It's not a quick, oh, look, your heart rate's at 120. Everything's great. Go home. It's the whole thing.
Mm-hmm.
I like that you brought it up, because we have seen that, online and with others as well, that they've been brushed off, and that isn't fair. And when you're at labor and delivery, at least you're on the monitor. It's all noted. It will be in your files, and go back again. If again, we can't stress it enough. If you were sent home and your baby still isn't moving like normal, you go back in, and you don't have to tell them that's been an increase or a decrease. My baby is not moving like they normally do, and just advocate for yourself. And we hate that people have to do that, but go back in and be stern. My baby is not moving like they have been.
Mm-hmm. And I had that happen at the end. I didn't have a decreased movement, but when they went to do at the end with my stuff, I went through non-stress test, and he wasn't moving. He was just like, I don't know if he was sleeping. I don't know what he was doing, but it was like I'm here. I had my scheduled C-section. So it was like 37 weeks I was pregnant. And she was like looking at it and she's like, I'm going to send you in. And she's like, he's just like kind of hanging out. And she didn't want to like get him going, nothing like that. She was like, no, I feel comfortable sending you to labor and delivery. They hook you up. They do everything. They'll do, whatever. And if I need to, I'll be over there and you'll have baby out kind of thing. She's like, cause right now he's good. His heartbeat was good. Everything was good. But she was like, I feel better that you go over there and just have them hook you up to all the stuff. So if you need me, I'll be right here and I'll talk to you on the phone. And she did. I got sent over. It was freaking scary. And I was like, oh my God, something's happening. And I didn't notice. And because she was like asking me about the movement that day, because they gave me a little chart. And I was like, yeah, everything, he's been good. I think I wrote it down on my phone or something. I don't even remember. But that I was like, no, he's been moving all morning and he moved in the night and he's been moving like normal. But she was like, I just don't like this. He's just not moving enough for your stress test. So that's why everything was fine. But she was like, I don't like it. He's not moving enough. And sure enough, I get over there and they're strapping me and all this stuff. And he's kicking the nurses as they're strapping. And the nurses were like, I think he's fine. And I was like, okay, he's awake. But they were like, but we're going to keep you for an hour anyways, because we want to monitor and just make sure that he's on. And I was like, okay, that's fine. But and then a week later, the same thing happened. A week later, they did another non-stress test and he was just like hanging out. Like, I don't know. And I went back and they were like, this time's it kind of thing. And I was like, no, I don't know. But I was like, whatever. And no, it was the same thing. He was fine. And that time they kept me, because now at this point I was a week from my thing. They were like, you've been here before. We're going to keep you a little bit longer. I think they kept me maybe 4 hours or something like that. They put me in a gown. They gave me an IV. They were ready. They were like, this could be it. We need to really monitor. And he came out fine. And they were like, if you notice any decreases in movement, if you notice this, they gave me like a list of things to go home. If you notice this anytime, even if you're driving home, just turn back around and go back to the hospital. And I was like, okay. And then I for sure thought he was going to come like the weekend before. Cause I was like, I just keep getting sent to the hospital, all the stuff. But no, he was fine and he made it to our day. But they were super, super awesome about it. They were just like, yep, like baby's good. So if we have to, we'll just get baby out. Like, and I was like, okay. So something to know in there.
Great example. And that's a great example of going back in. They kept you longer, and each hospital had their different like policies and procedures. But for you, they knew you were in for a couple of times before that. So they kept you a little bit longer just to make sure. So, I mean, this is like a great example of what we were just saying. And it always happens that way. You bring your kid to the emergency room or doctor and they were like lethargic and now they're all perked up. It always happens. And they know, they will listen to you. And just like when some parents don't medicate their child to show the doctor they have a fever, they believe you. Like they will believe you. They know your child had a fever. They know that you felt a decrease or increase in movements. And, that's what they're there for. And to kind of walk through that process, when you come in to labor and delivery, you will usually go into a triage room, which I think at this point, most, labor and delivery units do have a triage area, and you'll go in as a little room and they'll just hook you up. That I think they have still pink and blue belly bands and just kind of see the baby on the monitor right there. And like you said, sometimes they'll start an IV. They can find out you're dehydrated, but there's multiple things they look for, and you're in the best care at labor and delivery. Don't waste your time at the doctor's office. They, even if you have your OBGYN there, they do not have the resources available right there to deliver your baby if needed.
And that's why I got sent over too, was she did the stress test where it has the little tape comes out with the little things on it. And she was like, even though everything's looking good, he's not moving. And she was like, she could tell my heartbeat, his heartbeat, everything's whatever. That's where she just was like, I don't like it. He's just not moving. So let's go over there, because she didn't want to waste the time of her doing an ultrasound at the office when I might as well just go to labor and delivery and have them do the ultrasound, them do the BBP. And that's what they did. They had right away, the labor and delivery nurses were checking, doing everything. And then a specialized person came in and was doing another one on top. So even though they checked their stuff of what they have, their checklist to do, another lady came in that was just like the ultrasound, whatever lady. And we got basically checked like twice, really. So it was like a couple of them of the first time we were there, and the second time they were like ready for us, like really ready for us and everything. So I was like, okay. And they were like, this time it's happening, Danielle, you're having your baby. But it was the same thing. They sent in, and we had actually a third person come in the second time, because they were like, we need to make sure, because they knew also we couldn't stress enough. I lived almost 2 hours away from the hospital. So that's where they were like, if you start driving home and you notice anything, just turn right back around and come back in here. Because they were like, it's just safer to get your baby out than to take any chances with your baby in there. And you just don't know, stuff happens. So, but yeah, and they checked cord, they checked placenta, they checked a lot of things. While I got to hear full workups of my kid before he was born. So I can't tell you, like, and it was relieving too, because it's scary when you don't know, because you don't know what's going on the inside. So it's very relieving to see him on the monitor and hear everything that they're telling you is going on too. So I definitely, anything at all, like, I can't tell you all the stuff of like, just go in. Like, if you're questioning anything, just go in. It's probably like, if it's your hospital or whatever, just go there. They know who you are. Like, just go into any hospital. It's the best thing you can do, because if anything, you go home knowing your baby's okay. But if there's something, whatever, you have time, you're in the best place to deal with it.
I will say that, well, my first son had presumed maternal fetal hemorrhage, which is to say that he was bleeding out generally through the placenta into my circulation, and there is no bleeding vaginally that will show up. But what happens is he becomes increasingly anemic and increasingly compromised, even though the placenta is very fine, cord's fine, he's losing blood. So we had well, it wasn't a preconception appointment, but I came in pregnant with my second, and I said, so what happened the first time, and will it happen again? And they sat down and they said, well, we know what happened, but as for it happening again, we can't tell you. It's pretty rare, and it's usually only caught, like as it was for me, on the continuous monitoring during labor, or people report decreased fetal movement. So they said, well, as soon as he hits viability, which is whatever, 24, 25 weeks, you're coming in twice a week for the non-stress test. And for people who are worried about what it's like, well, basically, you get comfy, you put your feet up, they strap the monitor to your belly, they give you a clicker, they say, punch this when you feel a move. And it was one of the most peaceful moments of my week, was going in and spending 20 minutes just not having to do anything except punch a button. It was, and then, everything checks out. You get up, they say, until next time, you're like, cool, and you walk out. It really, it's not stressful at all.
No, and at best, it's reassuring.
Oh, yeah.
Mm-hmm.
You just basically say hi to baby. They tell you everything's great, and you walk out. It is such a relief. I tell you what, when you have it wasn't a high risk pregnancy per se, but it was one of those, I don't know what's going to happen. Please tell me everything's okay.
And I know with decreased movements as well with high risk pregnancies, sometimes they can spot the IUGR, which is interuterine growth restriction, which also kind of plays hand in hand with reduced movements. And with IUGR, there's an increased for stillbirth. So it's also something, like it may not be something your baby needs out right away, but you've already notified them, and, something that they can keep a watch out. And like, Ange said, you're given these list of things too, and just come back in. And Danielle too, like, here's your list of things to notice and come back in.
Now, is there any like apps or things now? I mean, that's like the new thing, is you have stuff on your phone. Is there apps for this now to like track the baby movements?
Right. There is one, and I've downloaded it, not being pregnant, just to try to see. And it's the American-based one, and it's and I cannot remember the name of it. Count the Kicks or Kicks Count. And it's the American version, and you can do your movements. So you take out the app and you hold your thumb like, oh, I felt a movement, but it only goes to 10. 10, you're done. and it's very outdated. So I don't know if there's any other apps on the market that you can kind of see like, oh, I felt my baby flutter, felt my baby roll or swish around and log the movement, because we're all busy. If you've got other kids working, anything, we're just so busy. So it's nice to have an app. So maybe that's something I can look in. But the most important thing is the 10 count, kick count is not kicking. And there is no set number of movements that's normal for any one person. It can, like I said, it can range from 12 to 38 to 100. 100 might be a little bit up there, but there are certain babies that are more active than others, and just sit down and know that 10 is outdated. Your baby may move 10 times in one session. That's completely normal for your baby, but 10 is not. And that's, again, like if you're calling the hospital and they say, oh, well, did your baby move 10 times? Yeah, but that's not normal for my baby. My baby moves much more than that. And so just advocate. So if there's anything that we can say, do not do your Doppler at home. Even if you're a medical professional and know what you're listening for, you still cannot help your baby at home. And most of the time, pregnant people don't know how to use it properly. You might be picking up your heartbeat and you're like, cool, baby's all good, but it's your own heartbeat, not the baby's heartbeat. And you can't listen or see the things that these labor and delivery nurses and doctors are trained to see. It's not possible. So don't use your Doppler at home. Don't drink or eat something sugary. If you're going to do that, do it on the way to labor and delivery if you want, but just get on your way. Call on your way. You don't even have to call in your third trimester. And again, there is no set number of movements that are normal. And again, kicks are not just kicks. You can feel them swish, flutter, roll, kick, jab their elbows up in you. I mean, we all felt it. It can kind of get uncomfortable, and some babies are angrier than others when they're moving, but you'll feel it. And like I said, we'll link to the anterior placenta one. The movements are very different, but you still should be able to count and register those for yourself and for peace of mind as well.
And I did want to add, a lot of people have been asking if a hiccup counts as movement. And it does not count as a movement. My baby was the hiccup king, and those were not movements.
Well, since I had so much time doing the non-stress tests in my second pregnancy, yeah, one time he was hiccuping up a storm, and they're like, nope, you have to have real movement. Hiccups don't count, because what they're looking for the non-stress tests is when your baby moves, their heart rate should change either before or after it happens. So hiccups are just like bumps, and their heart rate isn't changing at all. So either A, your baby's in trouble, or B, they're hiccuping. So that's the thing. Oh, also the thing about towards the end of pregnancy, your baby is, quote unquote, according to the myth, running out of room. Your baby should be getting bigger, and your baby should be getting stronger as they approach birth. So yes, you should be able to feel them. They should actually, sometimes they can get really, what's the word? The stretches they do. It's like, excuse me, there's only so much room. I don't have any more room to give you. Stop doing that. Yeah, they should be every bit as strong and powerful as they were when they were younger. They just have a little less amniotic fluid to swim around in, unless you have polyhydramnios, which I did. Beach ball.
I had with William, weird thing was I had a little extra fluid, but I was just under, so I was in the normal range. So I didn't go over to that, but they monitored me because they were like, oh, you could by the end, because I was getting more toward the end. So I was still right there in the normal range, but yes, I had a little bit, and that kid moved all the freaking time. That's why I was like, I don't know why he's not moving when I did it. It was like we would go to do the test and he'd just lay there, and I was like, I don't know. Now is he sleeping the whole drive here for the 2 hours driving here? He was like spinning and kicking me in the ribs and just everywhere. And then we'd get there and lay down and he's like, okay, now I'm tired. I'm like, no, you can't do this in a stress test. Like you have to move. So.
You have to move or it doesn't count.
Right.
Yeah. But yeah. Oh, that's the other thing that in case people don't know, I asked, I said, so the first time they hooked me up, I'm like, so what happens if we flunk the stress test? And they're like, oh, you go to the hospital. I was like, oh, really? They're like, oh, yeah. I'm like, oh, good to know.
Like me. Like me twice.
That's what happened. You flunked it, man. Actually, you didn't flunk it, but he did. So yeah, same difference.
It's very funny.
And I say, like,
it
you
worked.
go into labor and delivery when you have a concern, but your doctors can do that in the office, and usually they'll do that when a normal, healthy pregnancy, or they're just checking on you if you reach that past 40 weeks, and they do it for a variety of reasons before that. But if you're having a healthy, normal pregnancy, it's usually once you hit 40 weeks, and they can do that in office, and they know what they're looking for. So if something is concerning, they'll send you into labor and delivery. And that's not because, they don't know what to do. They know what to do. They're sending you there for reassurance, more tests, because like I said, if baby's still not good, they might keep you on longer on that non-stress test and see, but it's just a variety of reasons. So
also, there are more people there.
Mm-hmm.
So, your office only has so many slots, it has to crank those patients through. They don't have room to, squeeze you in between patients. They'll send you to the hospital. They can do that stuff.
Yeah. It's better than waiting for an appointment anyways. You could call and they're like, well, I can't get you in until 2 and it's 9 in the morning. So it's like, no, just go to labor and delivery and just be checked out versus waiting the whole day just to get in to be like, I think this is happening, no, just go in. It's just better to go in, and your doctor might even tell you that. I've heard of doctors where people have called and they're like, please just go in. Like, don't wait for us to try to fit you in. Just go in and I'll call from the hospital or let me know like when you get there kind of thing. And they just coordinate and whatever. And they're like, I'll be there if you need me. But they're like, yeah, go in. Don't waste any time.
No, I do remember that when I had an appointment that day, but it was later in the day and my water broke at 11 a.m. And I remember thinking, should I call them and ask them if I can just go to I didn't know if my water had broken. Let's put it that way. It could have been whatever else. So I said, I'm just going to call them and ask them because maybe they'll just move my appointment up and check me there. So I called and she's like, well, we don't have any other appointments. I mean, I guess you could come at 1:30 if you really feel it's a problem. And I was like, but I think my water broke. She goes, well, you can come in at 1:30 or you can just go to labor and delivery. I mean, you don't have to. And I was like, okay, I think I'll just do that. And sure enough, by dinner time, there was a child screaming and trying to get his hat off his head. So yeah, I'm glad I didn't wait.